Diabetes is unlike any other chronic illnesses in a way blood glucose fluctuates all the time. When you're sitting, when you're moving, when you're eating, even when you're not eating. So constantly your mind is always occupied by this condition. So this is unlike any other disease in that aspect.
Diabetes is a very impactful disease in people's lives because it affects their risk of heart attack and stroke and kidney failure when not managed. And even when it is managed, it's all-encompassing because it affects how you need to eat and exercise and medications. So it's quite overwhelming for people to put all the pieces of this together and manage it and feel in control, such that normally people feel quite consumed by the disease. It starts to define them, and their natural reaction is to kind of flee from that.
So as we look around our world today, the way we communicate has changed forever. But one area we felt that there was a big miss in healthcare is that there was virtually very little communication between healthcare providers and patients in between the visits. Diabetes is also a very different disease in a way that it's a self-managed disease. In other words, healthcare providers and coaches, they really provide information for you and skill set for you so that people living with diabetes can actually manage their diabetes himself or herself.
What we try to do is to put patients in a position where they could take the disease and feel like they had it under their thumb. Feel like they really felt that they were in control of a situation that was previously overwhelming, and that they had a partner on the other end of this technology that would really help them to overcome the hurdles that diabetes put in the way of their daily life.
In this case, the placebo group was actually standard care provided by a tertiary hospital, a renowned diabetes center. And so when we compare the results between using the mobile health device versus the standard, we found that there are three things we found. One is the degree of glucose improvement as characterized by a drop in hemoglobin A1c was greater in the experimental group using the mobile health technology. But not only that, we also found that it took less time for the healthcare providers to provide such good care, and in fact satisfaction rating went up much higher in the mobile health arm compared to the standard care. We have shown in this study is a direct translation into health outcomes, and I think this is going to be a very interesting area as healthcare is moving more towards patient-centeredness.